Today, we're going to talk about the steps, 3 steps to relieve lower back and hip pain. And this solution is part of the relieve portion of our R3 corrective program in our office, where we look to relieve your pain, rebuild and strengthen the body, and renew your health with corrective and wellness care services. Now, many people who are dealing with back and neck pain try 2 different things to help them with their pain, and those 2 things can actually be disastrous. Number one, pain medication. You can dull the pain, but if there's a structural problem in the spine or the hip, then you can do more damage. And the other problem could be rest. Yes, rest. It can be problematic because sometimes it can cause the muscles to weaken, and if they weaken enough, it can make your problem worse. So you'll either feel worse or you'll have the pain more often, or both, and we don't want that. So we're going to go over the steps to take care of this pain in the lower back and hip so that you can feel better, walk more comfortably, feel more flexible. We're going to talk about some muscles that create lower back pain that travel to the hip, and those are the hip flexor muscles, the iliopsoas and the rectus femoris. Let's talk about those. So if we look at the spine, the iliopsoas muscle, or the psoas muscle, starts at the lumbar spine. So it starts at the lower back and it works its way down into the front of the hip. So back pain that radiates into the hip so many times, that iliopsoas, that psoas muscle, is a problem. The other muscle is your rectus femoris, your quad muscle, main extender of your quadricep. So flexor of the quad, sorry. That muscle gets really tight. And as that muscle gets tight, that also can create pain. It starts in the back and works its way into the hip. So there's a couple of different things that we can do to help your iliopsoas, connects the lumbar spine down to the hip, or the rectus femoris that connects the hip into the leg. So let's talk about what we can do to help those areas. So the first exercise that we're going to do to help improve lower back pain that travels into the hip is the quad stretch. We got to really work on these hip flexors, and your rectus femoris, that large quadricep muscle, is a very important one. Now, there's a simple way to stretch the quad. You bring the leg behind you, you hold onto the ankle, and you just pull. That starts that stretch. But to really activate the important area that connects into the hip here, you actually want to push your hips forward as you do the stretch. And so as you rotate those hips forward, when you perform that stretch, it'll really give a good stretch from the quad all the way into the hip, and that's going to make a big difference in how that area heals. The other way that you can do this, especially if our balance is an issue, you can do this on your side. So if you lie on your side, you do it just like you would have done it when you were standing. You just take that leg behind you and you push the hips forward. You just rotate those hips forward. And as you do that, you're really going to feel that stretch. The next thing we want to do is we want to strengthen our gluteal muscles. The gluteus medius is a muscle that tends to get weak. And so the muscles up front get tight, the muscles in the rear get weak, and then that imbalance leads to that pain that starts in the back and works its way into the hip. So the way we're going to work that out today is with some really simple hip bridges. You just lie on your back, you have your knees bent, you tighten up your abdominals, and then you push the hips up. You hold for a couple seconds and relax. Repeat that 30 times. And we'll do it once a day. That will strengthen those gluteal muscles that will help provide some stability in the lower back and pelvis. Follow these steps to improve that lower back pain that goes down into the hip. They're really wonderful. But it is possible that there's more going on than tightness or weakness in the muscle. Typically, this muscular imbalance is caused by an imbalance somewhere in the lower back and pelvis. So you may be better off having a complete evaluation by your family chiropractor to help you understand the complete cause of your pain that you're experiencing. In our office, we'll do an evaluation, we'll take x-rays and come up with a complete program that's going to help you feel better and really be healthier. So don't settle again for a life of hurting and suffering with lower back and hip pain. Take those steps, come see us, and we'll take good care of you. I'm Dr. Emil Tompkins, and I hope you have a great day.